when it comes to talking about what is normal, what's important is to take into account the perspective that the individual is coming into the situation with. So let me just use a very basic, a very common kind of common case. Let's say that you have suffered some kind of an injury, and it was in the past, and it could have been a very severe car accident. It could have been a very severe sports injury. It could have been a very nasty fall that shook you, that scared you, that you look back on it and wonder, how did I actually survive that? It could have been severe enough. And so what you did was you maybe went to the hospital, or maybe there were the paramedics on site, and they did a quick test of you and all that sort of stuff, and they came to the conclusion and they said, no, you're fine. Or maybe they did do a few scans, like a couple of x-rays or a CT or something like that, and they said that, okay, everything looks normal, you're good to go, you're okay. And that's fine, maybe you were at the time. But unfortunately then, you've kind of always wondered in the back of your head, you know what, was I actually okay? Especially now if you are starting to experience some symptoms or some kinds of problems, much later down the track, wondering, okay, could these things be connected? And it can be, really any number of different things that, never used to be there. So maybe you're experiencing more headaches than you ever used to. Or maybe you were experiencing a dizziness or vertigo or pain in different parts of your body that never used to be there. Or other kinds of degenerative or neurological issues that, some people are saying is either a virus, or it's, quote, just because you're getting older, or something like that, which, I usually disagree with vehemently. And that is because a good chunk of the time, it's not because you are older per se, because if it was, everybody who's your age would have the exact same kind of symptom. But if you are an exception to that rule, then it means most likely something is different. Classic example, a person comes in, they say, oh yeah, I'm, have a degenerative arthritis in one of my hips. And they say it's because I'm getting older. It's like, okay, fascinating. Is your one hip, by chance, older than the other one? And people kind of look at me for a second and say, well, no, of course not. That's a silly question. It is a silly question, because if it was just a matter of old age, it would be the same in both hips. Or if it was your spine, you would have the same amount of degenerative arthritis and the same amount of pain at all of the levels. But that's also not the case either. But one way or another, let's say that you're starting to have some issues and you go back to your GP, or you go to a specialist, or you go to whoever it is, and they do a series of tests. Maybe they do some blood tests, maybe they do an x-ray, maybe they do a CT, maybe they do an MRI. Whatever it would be, or maybe some combination of all of these things, the results come back and the results keep saying that everything is normal. Everything looks normal. All the results are within the normal range. They can't find what is actually going on. And in this regard, especially if you are suffering with something that is having a severe impact on the quality of your life, you can be feeling very frustrated in this. Nobody wants to be told that you have a certain diagnosis or you have a certain problem in your body. And yet, if you're experiencing something, you want to know that what you're experiencing is real. That it's not just something that you are imagining, that it's not just something in your mind, that it's something where somebody can take a test, somebody can do something and say, there's what the issue is, because what that means is it gives you the opportunity to be able to do something, whatever it would be, in order to help improve your overall quality of life. But when everybody keeps saying that everything is normal and you feel everything but normal, you're left wondering what to do. Now, this is what I want to share with you, and hopefully this message will resonate if you're listening to this, because you need to hear it. It has to do with what your perspective on normal is. You see, if you are a paramedic, if you are a radiologist, if you are a phlebotomist, and you take these different kinds of tests, what you're looking at is you're looking at things kind of in a range like this, and it's called a range of pathology. And from their perspective, it's that if you have too much to the one side, beyond that limit, that's going to be pathology, that's disease, and that's the point where you need to jump in and you actually have to do something. Similarly, if you have too little of it, that is also pathology. It's disease. You have to jump in and do something about it. But everything that's within that range is quote-unquote normal. But now here's the thing. Just because that might be the normal range, the true range for healthy looks a lot more like this. And so you can be sitting in one of these gray zones off to the side. You're not all the way yet to the point of pathology, but you are not healthy either. And so you do not have the diagnostic criteria to be told that you have certain disease or certain disorder or certain condition, and yet you still exhibit many of the symptoms, many of the hallmarks. It's just that your tests are not showing it just yet. And if a person is coming into it with black and white thinking, that is, unless you reach that diagnostic criteria, you don't actually have a problem, everything is normal, it's very possible that you will be missing some very significant issues. I kind of use the analogy, as silly as it sounds. Let's say that you are just a little bit overweight, you're feeling a little bit more fatigued, you can feel general weakness in your body and things like that, and you think, you know what, maybe I should be going to the gym, or maybe I should be doing, some more exercise, maybe I should improve the quality of my diet. Well, using the same kind of logic, it would be as if saying, no, you're not fat enough to exercise yet. You're not morbidly obese, and so not until you meet that diagnostic criteria, that's when you have to start exercising. That's when you have to start working on your diet. When, of course, that's absurd. Wouldn't it be a lot better to prevent disease, illness, and all of this sort of thing when we can, so that while we are in that gray zone, we listen to what our body is saying, so that we're able to bring and get ourselves back into that true healthy and normal range? And this can be a lot harder, because what this means then is this depends very much on the skill and the knowledge base and the wisdom of the individual practitioner that you are working with. Nobody, and I do mean nobody, has it all figured out. I don't. Nobody that I know does either. We all see things from our own individual perspective, whether it's looking at blood tests, whether it's looking at diagnostic imaging, whether it's doing additional kinds of procedures and all this sort of stuff to help and figure out, when people may not have that true blue pathology, what is actually going on that is ailing them. So, consider my perspective. Okay, I, by trade, I'm an upper cervical chiropractor. I look at the relationship between what is going on between the structure, alignment, motion of the joints in the upper part of your neck and how they influence your spinal cord, your brainstem, your nerve system, which is ultimately what's going to be giving rise, expression to all of the life processes that are going on in your physical body 24/7. And so you could appreciate then that if there is perhaps something that's going on in that area, it can have deleterious impacts that can show up in any number of different parts. Why? Because you cannot disconnect your brain from the rest of your body without there, of course, being very severe impacts. Even if it's only 1% less than your normal ability to express full health, full life. Do you want that? If you could be 100%, but you're operating at 99%. Is that good enough? And everybody has a different line. Some people would say, 90% out of 100? Well, I'm not going to complain about that. That's not too bad. But let's say instead that you're living down at 60% of your total potential, and 80% was possible. Why would you settle for less? If you could do something about it. Now, a little bit of a sidetrack there, but what's my point? It's like, okay, when we're looking at different kinds of injuries that can actually happen to a person's neck from a simply put physical standpoint, well, the most severe is going to be fracture. The bone is broken, the joint is broken, the nerve is broken. And this is the stuff very, very serious. You don't muck around with that. Emergency department immediately. Same goes with gross dislocations. Typically, that's going to occur when you have a grade 3 ligament tears. The ligament has completely ruptured, or it's become very unstable, and the joint has shifted beyond 50% of its normal range of motion control. It means that things are moving way, way, way too much, and unfortunately, you move your head or your neck at just the wrong angle, and that can cause some very serious impacts. Now, if you are a paramedic, if you are an emergency room technician, if you are a radiologist, these are the things that you're taught to look for. That is your perspective. You're looking to see, do these people have those kinds of conditions where their life is in imminent danger? And let's throw in there significant amounts of bleeding, infections, tumors, all of these different kinds of things just like that. And from their perspective then, if you don't have any of those things, what are they going to say? They're going to say, you're normal. But that's the perspective thing right there. Just because you don't have those particular kinds of conditions that are perhaps affecting your upper neck or your nerve system or whatever other part of your body it might be, does not necessarily mean that things are normal. And sometimes they'll say, you know what, maybe it is. It's just sore muscles, or maybe it's just a mild sprain, or maybe it's just a bit of something like that, where the normal innate wisdom of your body, you know what, go home, lie down for a few days, and it should get better on its own. Well, guess what? I completely agree with that. Your body has the amazing capacity to heal from just about anything that you can conceive of within limitations of time, matter, gravity, all these sort of things. In other words, within reason and the laws of the natural universe. But your body is designed to heal. And normally it should. But what if it isn't? You see, it's very easy to blame things on a virus or a muscle tweak or something like that if you're experiencing a few low-grade, not severe, but, unpleasant enough symptoms that don't go away within just a few days or something like that. But I will say this, is that if you are experiencing issues that are dragging on over more than a week, more than a month, into a few years, even to a few decades, that is not normal. Something clearly is going on. And what that means is you're not dealing with just a virus. You're not dealing with just a low-grade sprain, strain. You're probably not dealing with something where you just need to retrain your muscles a little bit. And you're probably, let's face it, also not dealing with something such as the very severe dislocations, fractures, all that sort of stuff, because guess what? That would have showed up an awful long time ago. You are most likely dealing with something in between. You are dealing with something that is in that gray zone. It's not broken. It's not dislocated, but it's something that your body is not quite able to fix on its own and needs that extra little bit of support to be able to get over the hurdle. And in order to figure out what that is, what this means is you've got to be working with somebody who's willing to do the hard yards with you, and that is to look into that gray zone. It's not straight out pathology, but it's not healthy either. Something is affecting your body's ability to heal and to be well. And you also then, you have to be willing to do whatever it takes in order to get there. I say this to pretty much everybody that I work with. Again, I do not have all of the answers. And most of the time, when it comes to healing, it's going to be a process. Your process, as far as how you got to be unwell, was very likely not the result of just one thing either. It took time for you to get there. Well, guess what? It's going to take time for you to retrace, to unwind, to go back through all of those different phases and steps. And what that means is it means that there's probably going to be a few dead ends along the way. It's going to be where, okay, well, nope, we don't like how your body is responding to this. We need to reverse course. We need to learn from that. We need to keep working forward to find out what is it that your body ultimately needs to be as healthy and well as is possible. And so it can be very challenging. It can take an awful lot of time. It can be very, very frustrating. But let's face it, because this is the reality of the situation, is if most likely you had something that was going to be straightforward, simple. If you had something that from a diagnostic standpoint was very easy to identify and thus very easy to treat, odds are somebody would have been able to figure out an awful long time ago. But if you're watching this video, it's most likely because you've said it to yourself, you've done a Google search or something like that. Why is it that I have these symptoms? Why do I have these problems when all of my tests keep saying that everything is normal? I've been to see all of these different people. What could still possibly be going on? And again, I'm not going to pretend that I may have all the answers, but what I can say is different perspective. We each have a different piece of the puzzle to solve. Some people, that's the last thing that they need. You've already done all of the right things. That's just the last one. It looks like magic. Other people, some of the things that I do, I'm the very first piece of the puzzle they need. And guess what? There's a whole bunch of other work that they need also. In which case, we can be doing the absolutely right thing, but guess what? It's not going to solve everything for them. We have to be realistic, and we have to be true, we have to be honest, we have to look at the facts as they are given to us, and then we have to do the very best that we can with the information that we have in order to ensure that we can achieve the best possible outcomes within the best possible period of time. It takes work, takes a lot of work, especially when we're dealing with things that are in that gray zone. But ultimately, it's what we have to do. Because really, at the end of the day, we have a choice. And the choice is that we can continue to exist in that space where we are right now. Or, as difficult as it can be at times, especially if you've already done all of these different things and you've had your hopes up, but you've been disappointed time and time again, you have to be willing to take that risk that one more time, or however many times it takes, to do something different so that you may finally be able to find that thing that you're looking for, so that you can get back to enjoying that quality of life that you really want and that you really deserve.